We will now demonstrate how volunteers should prepare themselves. Firstly, we recommend that volunteers wear clothes that can be washed in the washing machine at 60 degrees. We recommend that prior to wearing personal protective equipment, volunteers ensure that they are well hydrated, they have used the toilet, and that they bring with them a change of clothing. Anyone who is currently unwell must not volunteer or attend. The first step that must be completed prior to wearing PPE is hand washing, which we will now demonstrate. Before starting, remove any jewellery, rings or watches. When washing your hands, ensure that any sleeves are rolled up and that you are bare below the elbows. Start off by wetting your hands and then applying enough soap to cover your hands. Next, scrub the backs of your hands and the area between your fingers. Do the same again, but this time with your palms facing each other. Next, scrub the backs of your fingers with the opposite palm using a ringing motion. Then, scrub each thumb in turn. Next, use your fingers to scrub each palm in turn. Rinse your hands to remove all the soap and then dry each hand thoroughly with a disposable towel. Use your elbows or the disposable towel to turn off the tap. Next, we come on to wearing the personal protective equipment or PPE. This will include a long-sleeved, fluid-repellent disposable gown, gloves, preferably with long, tight-fitting cuffs, a face mask, and eye protection, such as a single-use, full-face visor or goggles. Prescription glasses do not provide adequate protection. PPE must be worn in a clean area outside the ghusl room and with the supervision of a PPE buddy who should be a healthcare professional. The first step is to wear the gown with the assistance of your PPE buddy. The gown should be worn from the front. Thereafter, your buddy will need to secure this at the back of the collar and by using the waist tie to ensure it is secure and that there are no gaps. Do not use the inner tie of the gown. The second step is to wear your mask. You may need to remove glasses before wearing the mask. The tie at the top should be tied near the top of the head, at the back. The mask should then be pulled down so that it covers the mouth and the chin. The second tie can then be tied at the back of the neck. The mouldable strip should be moulded around the bridge of the nose. Your PPE buddy should ensure that the edges are tight to the skin. The third step is to wear goggles or a face visor, which can be done over the top of glasses if required. The final step is to wear single-use disposable gloves. Ensure that the sleeves of the gown are tucked into the cuffs of the gloves. If any tears occur whilst wearing the gloves, discard them and use a fresh pair. Before entering the ghusl room, ensure that your gown, mask, eye protection and gloves are all worn correctly. That concludes the section on wearing PPE.